So I checked my orders. We have an order for an NG tube for our patient here. So I'm going to come into the room, say hi. My name is Luke. I am your nurse today. Can I get you to verify your name and date of birth?
Oh, for the...
She'd verify it. I would check. I'd probably also verify it against the MAR. I'd verify against her bracelet. Good. This is the right patient. My name is Luke. Ma'am, I'm going to be helping you get an NG tube in today, all right? That's a nasogastric tube. So we're just going to get a tube. It's going to go from your nose down through to your stomach. It's going to be there to help decompress your stomach, okay? So I'm going to get all my supplies ready. I'm going to get some gloves on. Do you have any allergies that you know of? Any at all? None. So I also have with me some lubricant for the NG tube, and it's medicated. It's got lidocaine, so it's a numbing agent that'll help this be a little bit more comfortable for you. Is that all right? So when we're doing this, just let me know at any time if it's uncomfortable or not, and then we can stop. And if we need to, we can do it another time if it's too painful. So what I'm going to do first before I place it, this needs to be capped, is I'm going to measure from the tip of the nose to the earlobe, and then from the earlobe down to the xiphoid process here, just past your sternum, right about there. I'll go just between that and your belly button, so right about there. And there's already tape there, so right at where the tape is where I'd go. I had some tape ready for it, but we got that. So I have my mark. I'm going to get my lidocaine, lubricant, good. So, and actually I'm going to place this on your nose first. This is just going to be there, so once it's inserted, I can have it held in place, all right? So, I'm going to have you tilt your head back for me so I can get a good look at your nares. What we're going to do is I'm going to get this in there, and then once it gets to the back of your throat, I'm going to have you put your chin to your chest. That way it blocks off so it doesn't get into your trachea, all right? All right, ready? We're going to start doing it nice and slow. All right, so it's hit the back of your throat now, so I'm going to have you tilt your head forward, put your chin on your chest, keep going, and then I'd go until the point where I got to my mark here, but that's about as far as it's going to go. Okay, you can tilt your head back now. I'm going to keep this secured in place with my tape to the best of my ability.
But you already said it, so it's okay.
Good. All right. I'm going to go ahead. This is going to get hooked up to suction. But first, before I check the suction, I'm just going to make sure that the placement is good. So I'm going to open this up. I'd get a syringe here. Actually, I can take this out. Get about 15 to 20 mils of just air. And then what I'm going to do is I'm going to acetate your stomach area just to make sure that it's in the right spot. I'll push the air in quickly, that way I can hear it. Alrighty. And I can hear it. And then on top of that, the next thing I'm going to do is I'm going to get out about 15 to 20 mils of gastric contents.
I just leave the recording to start anytime so I can have it.
Just pretend we have it. Put it in our little first.
start anytime.
Put it in our cup here. We'll use our gastric pH strips to check the pH. We got them in there already. This one's yellow, and that would mean that the pH is between 3 to 5, which is normal. So we're in the right spot. The placement is confirmed.
Catheterization. So I coming into the patient room. And
Right, last but not least, I go over here and I check my
today
suction.
I'm going to do fully catheterization.
Make sure it's. I'm gonna attach it first, and then I'll make sure that everything is set up.
Can I verify your name and date of birth? Okay. And do you have any allergy? Okay, no allergy, no latex allergy.
It's hanging good.
I
And then we make sure that it's set to intermittent,
privacy,
and then the line would be in the green to make sure that it's the right amount of suture.
hand hygiene,
Right.
and put on glove.
Ma'am, you are all good. Can I get you anything else before I leave? I'd make sure the bed is low, the call light is here. I'm gonna go ahead and get all this documented. Let me know if you need anything else, okay? Do my hand hygiene as I leave, document my findings.